Hey guys, welcome back to my channel. Today I want to make a video on what is the most important class in nursing school. What's the most important one to take? What's the most important one? In my opinion, the most important nursing class is A&P, Anatomy and Physiology. That, to me, is the most important. The reason I say that is because A&P is the baseline for everything. The precursor, the baseline. We as healthcare professionals, we need to understand how the body is supposed to work. Because us in healthcare, we're dealing with people whose bodies are not functioning correctly. So we need to understand, how is the body supposed to be working? Like, how is the heart supposed, like, what is normal for the heart? Okay, I see this guy's heart rate is 43 beats a minute. Like, what's wrong with that? No, we need to understand that unless he's like an athlete, like a very fit guy, that a heartbeat of 43 isn't so normal. That's going to mean that his QTC is prolonged, which puts him at more increased risk for arrhythmias, which, more risk for, a sudden, for his heart to stop. So yeah, we need to understand how the lungs are supposed to perfuse, and why, like, why we're not supposed to hear crackling and noises in the lungs, or how often the bowels should be moving, or when we palpate an area, why we should feel the liver here instead of here, by this rib instead of by that, so we need to understand that. So A&P, and it's going to follow you throughout your entire nursing schooling and profession. Pathophysiology is also a big one, but patho is like the counter of A&P. So A&P tells you exactly how the body is supposed to be working, where pathophysiology tells you about every way the body could not be working, right? Like, it tells you every disease that the heart could have and every way that the heart could go wrong. So yeah, to better understand pathophysiology, you have to understand what is the baseline, what is supposed to be normal. So let me see. I wrote a couple notes here. So let me see. Let me share. I know one that in nursing school, the other big one, but for nursing school that is important, is pharmacology. I know for me in my nursing program, we had to look up every single drug, we had to know every single side effect, and we had to recite it. Couldn't look at papers. We had to recite it to our instructor in the clinical setting before we were allowed to pass meds. If you didn't know what each and every med was, what it was for, what are some how is it supposed to work, what are the results we're looking for, and then what are the adverse reactions that we're looking for, and what are some side effects that we're looking for. Like, if we didn't know all of that and like how it's working in the body on a molecular level, we could not pass the medications. So while it is absolutely important to know that and understand that as a nurse in the clinical setting, you will have more help as a nurse. At my facility, we use Epic charting system, and in our EMR, we every medication, if you click on it, it will show the class, what kind of class of drug it is. If it's an anticholinergic, or a beta blocker or something like that, it'll tell you what it is. And then if you still aren't sure, there's hyperlinks that you can click right next to the medication that'll take you to like a patient education sheet that will tell you, this is the med, this is how you pronounce it, this is what it's used for, here's some other names for it, this is how it's supposed to be working, here's some side effects, here's some adverse reactions. Like, you can see it. And absolutely do that for medications that you are not familiar with, because in nursing, especially in hospitals and with how drugs change all the time, there will be medications that you will be given like every day. You know, you're going to be given like a Colace every day to somebody. You know, eventually you're going to know exactly what Colace is for. You're going to know what to look for. You're going to get that. But then there are some medications like for like cancer or certain type of like antidepressants or, you know, drugs for like Parkinson's disease, all type of stuff that you'll see. New heart medications, even new blood thinners that you'll see, and you'll be like, oh, I don't know what this is. It's you need to know what you are given. So definitely look at it and make sure, because sometimes doctors can get it wrong and that patient is allergic to that type of medication. You'll have to tell a doc like, hey, that's one of their allergies. You know, they list as one of their allergies. They don't, you know. So definitely know what you're giving. But yet in the hospital setting, you will have more help, because it definitely depends on what type of charting system you have. In Epic, it's there, and we're able to see exactly what it is. But yeah, so yeah, like in the hospital settings, not so important. It's important, but not as important as like A&P. A&P, you need to know what's wrong with your patient and why that's wrong with them. But yeah, in nursing school, pharmacology is definitely right up there. Definitely a very close second to A&P. So yeah, let me know, guys, if you agree with this. If you think a different class is the most important, let me know what you think. So yeah, thank you. I hope you enjoyed it. Until the next one. Bye.